steroids after 40 years old, understanding the risks. Today's video. There are millions and millions of people starting anabolic androgenic steroids. This is not TRT. This is definitely not talking about all the millions of men that are starting testosterone itself at whatever age. This is just about you're a man and you're over 40, you've never done androgens or steroids, and now is your time. This is what you want to do. Today's video, I want to bring your thoughts to a place where you could understand the science and my clinical history of taking care of thousands of men on steroids for over 20 years. Here we go. First off, the data. Well, there really is no data. We know that most people that start steroids do so as teenagers, unfortunately, late teenagers, 20s, and then it starts to wane in that Gaussian curve towards 30 or 30 something. But we really don't have any data. So we know, though, that that's the bulk. However, because of social media and because of the nature of the beast and the forces at hand, men that are over 40, even into their 60s, it's kind of mid-age crisis on steroids, are starting steroids out of nowhere. They've never done them. They weren't bodybuilders, powerlifters. Now they're finding it because it's so common. And I want to educate you, gentlemen, on exactly what you're looking at and what the risks really are. Because I see this in my practice. Guys are coming in for consults, and I'm like, wow, I've never seen it like this. In the last 5 or 10 years, numbers are definitely going up. So let's talk about what actually are steroids. First off, it's going to be what's called supraphysiologic testosterone. That's taking TRT testosterone, usually injections, propionate, cypionate, enanthate, Sustanon 250, and taking a bigger dose than you would for TRT. That's it. Doses typically up to about 400 to 500 milligrams per week. That's steroid dose when you look at testosterone esters. Next, other sundry steroids, common steroids. Oh, they're probably 30, but let me just hit a few of them right here. Anavar, Equipoise, Dynabol, Anadrol, Winstrol, Primobolan, Masteron, and you better believe it, old school and new school Trenbolin, acetate, and enanthate. Absolutely unbelievable. And let's not forget Decadorabolin. So those are the steroids that are being used firsthand by men that are 40 and older getting on for the first time. Let's talk about the health dangers potentially. It's definitely going to be increased with age. That's why I'm doing this video. You know, it's amazing that young men take risks with car driving, jumping off of cliffs, steroids, right? Now, when they're young and they do steroids, essentially no one gets hurt. That's this whole danger in that slippery slope of anabolic steroids when it comes to health risks. Because when you're young, your body could absorb it. You have incredible resilience. But as you get older, everyone knows that you lose that. Older people die. They get older. It's cardiac disease, cancer, all these different things. So with a susceptibility risk analysis, this is how I want to complete this video today and work and provide you guys protection. So when you look at the risk of steroids, it's just going to be amplified. So this is secondary mainly to cardiovascular and hematologic risks. I want to make it very easy for you to understand it looking at this video and having things identified. Number one, blood pressure. And as you get older, blood pressure is becoming a problem. Then you're putting it on steroids, not to mention TRT. You want to get on the Anabolic Doc app so I can help you use your primary care doctors and your healthcare networks and really understand what you need to do from a clinical perspective. Next, arterial, myocardial, and endothelial forces. Guys, big words here. This is your heart. This is the arteries. And inside the artery is the inner wrapping. It's called the endothelial bed. It gets destroyed over years with blood pressure, cholesterol, sugar, diabetes, smoking, alcohol, life, just aging, inflammation, oxidation. Come on, guys, you know all this stuff. When you look at this, I'm breaking down point by point exactly what you can do. Those are called destructive endothelial changes, adverse changes. Steroids absolutely have an impact on this. And as you get older, it's going to be amplified. Let's break this down. Those arterial, myocardial, endothelial forces. One, lipid. That's going to be where the good cholesterol is going to go down from the steroids, dose dependent, and it's definitely going to be man dependent. It's going to be dependent on how many steroids you put together, how much, what times. Common sense, guys. So it's going to affect the good cholesterol goes down, you lose protection, and the bad cholesterol goes up, even with a little anavar. But is it enough to cause a heart attack? Guys, focus on this stuff. Next is called what I call hypercoagulable states. Those are the blood clots. Now, this is more on the venous side. It's called venous thromboembolism. And in the end of the management part, I'm going to talk about that. That's where the steroids itself, again, not to mention getting older, having medical issues, you can get blood clots in the legs that go up, and it's called pulmonary embolism. You see this, bodybuilders die. They don't die from brain cancer, even prostate cancer. But be careful, they die from blood clots. On the venous side, it's a DVT and a PE. We see that. I've done videos on the guys that die. It's so sad. And on the arterial side, it's just simple heart attacks and disease of the heart. So that's the next point, is left ventricular hypertrophy and lowering your heart's contractility. It's called the ejection fraction. Heart failure, guys. We have data for that. You could put in steroids and Harvard studies, Dr. Aaron Baggish, and you'll see where he's done studies on steroids. These are young men using steroids. It lowers the ejection fraction, guys. You don't want that. That's early heart failure. Let's keep going, guys. Another very important part, crucial to understand, is something called venous thromboembolism, DVTs, hypercoagulable state. What this is on the venous side, on the vein side of our bodies, where the pressure and the flow of the blood is returning back to the heart and it's slower, people can get blood clots. Okay, these are blood clots, typically in the lower limbs, and then they can form together and travel north, we say, into the lungs, and it's called a blood clot. If it's big enough in the lungs, it's called a pulmonary embolism. And this is very dangerous and it kills people. So you might hear that, a DVT, a blood clot, or a PE, pulmonary embolism. This is the stuff that's all wrapped up together. I'm going to really hit this more on the management side, but anabolic steroids have multiple mechanisms of action why they increase this, and they do, to different extents depending on your fingerprint, who you are. That's why steroid use, when I looked at this 20 years ago, and of course I did steroids, I looked at it and I said, boy, this is like so complex. How come some people die early? Some guys are older, they're doing good. Oh, no one does steroids, he didn't do this much. Some guys can do a lot, some guys can't. These are the pieces. It's the blood pressure, it's the arterial side, it's this venous side, it's the blood clot potential. So this is something you have to understand. And the last part that's really more of a complication on top of the things with the arterial clots, hypercoagulable states, and the blood clots is the polycythemia. It's called androgen-induced erythrocytosis. That's producing too many red blood cells, okay? When you're on androgens, depending on who you are, again, what you're taking, just testosterone can do it for a susceptible man. you are going to increase the red blood cells. I'm providing you education and even management information on what to do about that with your caregivers. It's very complex hematology. It's hematology on steroids. So this piece right here, this androgen-induced erythrocytosis, we know it is polycythemia, too many red blood cells. And the deposition disease is part of it, but also apart from it, if you have genes, typically for hereditary hemochromatosis, we've discovered that your iron levels that are measured through ferritin, and I'm going to give all this stuff to you in the management plan, can be measured, and you'll see it's all silent that your levels can be elevated or actually very low if you're giving too much blood, and you could range from feeling poorly to having really a secondary polycythemic condition. These are the hematology guys that I work with, where you get iron deposited into your solid organs, commonly the liver and the heart. Guys, it's called hereditary hemochromatosis. And if you have those genes, because you're from Northern Europe or Caucasian, African Americans and other ethnic men can have some of this stuff too. That's why you need to listen to me and understand what to ask your doctors for these videos, exactly pointedly what to do, because I'm the expert at it, guys. I don't know everything, but I know this. And if I don't know something, I know where to go. So you are going to learn where to be directed with these videos and with my Anabolic Doc app. Now time for the management plan. Most important piece here, guys. So this is the management what to do list of action plans here. First off, if you're on steroids or you're thinking about anabolic steroids, you need to get a very good history and physical done, hopefully by an experienced internal medicine doctor. That's it. It can be a family medicine doctor, it can be a general practitioner, it can be a nurse practitioner that has experience. It preferably should not be a specialist, even though they're excellent, endocrinology, urology, because when you're looking at this from the early stage of overall health and risk, you need an old school internal medicine doctor to do this. And I'm going to bring you through it right here. Family history is crucial for heart disease, for the blood clot diseases, right, guys? I mean, people that have this in the family, you're like, oh yeah, wow, this is really true. Factor V, right? Protein S and C, early heart disease. Guys, there's no medical care anymore. Like doctors like me that are standing on top of you, that are really, really experienced with this stuff and know how to take you in and protect you. You have to do it yourself now. You also need vital signs and you need focus studies. Let's go. Let me bring you through it. These are my ABCDs. I'm going to say it again, guys. I say it a million times. This is going to be 1,000,001. A stands for hemoglobin A1C, alpha 1C, and a comprehensive metabolic panel. It's going to look for, do you have the beginnings of prediabetes or type 2 diabetes? We're not going to talk about type 1 diabetes. It's not part of this scale. Most of people in America, for an example, in North America that are overweight, have obesity, getting older, getting heavier. That's why, again, this is so complex that you're starting steroids over 40, guaranteed to be risks because of the underlying issues that you have in your arterial and venous systems that's quietly sitting that you don't know about. So A1C is going to be checking to see how your glycemic index has been controlled over the last 3 to 4 months. And almost half of America is pre-diabetic. You could fact check all this stuff. And I'm not here to hate and to say everyone's fat and stop getting fat and start eating better. Come on, guys, we're beyond this right here. So, but if you are pre-diabetic, or not to mention really type 2 diabetic, you've crossed that line with the A1C and the fasting sugars, and again, you don't know. You have to do this yourself now with your doctors, with internal medicine. You are going to be potentially at risk because you're going to have coronary artery disease. It's silent. Let's keep moving. A, okay, hemoglobin A1C. B is blood pressure. This is imperative. You're 40-something years old. You're hypertensive already. You're going to go on Test and Deca. Oh, my Lord, guys. Your blood pressure is guaranteed to go up. Your blood pressure is already up at baseline, guys. Blood pressure is B. All these forces, if you will, these vector forces, these are basic vector forces that lead to coronary artery disease, #1 cause of death in the country. You see what's going on, guys? So now you're going to put it on steroids. I'm breaking it down, keeping it so simple for you guys. You could micromanage this stuff yourself without steroids. I'm just saying, if you go on steroids, you're going to accelerate this stuff. Yeah, you're not going to accelerate the sugar stuff. Anything that builds muscle, boom, and rips off fat, probably going to be good for your glycemic index. But is it worth it? Let's keep going. Steroids and even testosterone, it's going to affect the blood pressure. How much? Maybe it doesn't him. When you're young, you have resistance. You're very resistant to change. You could take a 2x4 to the face of a 19-year-old, 20-year-old. They go to war and they come back. The grace of God. But when it comes to this stuff and you're older, common sense. B is blood pressure. C, these are all important, but this I think is something probably the most important because you could do something here. Coronary artery disease. I told you it's #1 killer in North America. You could get a coronary artery calcium score, okay? I have it right here. You could see it on the video. You can get an echocardiogram to look at your ejection fraction, your left ventricle size. Doctors, please work with them. If they ask for this, they're not felons. They're not looking for heroin or steroids. They want a calcium score. They're over 40. They want an echocardiogram. Maybe they're hypertensive. Please, please. Why would you not give it to them? D stands for Deposition Disease. This is the red blood cell stuff, guys. I just talked about it a few minutes ago. This is where men use steroids, even testosterone, and it affects your red blood cells. This is on a CBC, stands for a complete blood cell count with a differential in platelets. You want to focus on the hemoglobin and the hematocrit. You want to get full iron studies, including ferritin. And then you want to put it together with all my videos to understand what's happening to your hemoglobin hematocrit related to the iron studies and the ferritin. Guys, I can't tell you how important this is and how esoteric this is. And there are a lot of doctors that prescribe testosterone and they don't check the iron studies. Everyone's checking the CBC, hopefully, and they're just phlebotomizing everyone potentially when you are very low on ferritin and you're depleted of iron. So it's not just, oh, doc, I got to phlebotomize, right? I'm on Anavar and steroids, now I got to phlebotomize more. No. N-O. You need to understand it. Guys, you're smart. And here's a warning. If you go on steroids at any age, there's going to be a lot of work to do. Are you up to the work? That's your challenge. If you do, certainly going to be protected versus a guy who doesn't do the work and the monitoring. I'm trying to make it scientific. So back to D in deposition disease. If you have a family history, see there's that VTE, venous thromboembolism. If you have blood clots in your mom or your dad, or you've had a blood clot, you have to understand the relevance of what could happen here when the red blood cells go up, not to mention just being on the steroids, as I explained above, in that physiologic paradigm of how steroids affect cardiovascular and not to mention venous thromboembolism disease. Let's move to S. S stands for me, for this presentation, for serotonin. That's mood, PSA, and sex. Guys, if you have any underlying mood disorder, depression or anxiety, general anxiety, I do. If I'm gambling in Vegas right now, you do. Is it severe? Has it ever been severe? Are you on medicines to help this? I've had to use medicines. I'm a human being. You take steroids at any age. This is kind of like the age has nothing to do with this stuff. You can have panic attacks. It will shut off your endogenous testosterone, whatever degree that you have. You're over 40. You're still young. And you are going to have roller coasters, moods, swings. Potentially, It's not all just rock on, guys. That's the bullshit stuff that we see here on the social media stuff. Hey man, what's going on, guys? Boom, boom, boom. Sexy stuff, guys. I'm here as a guidance for you guys, and very, very something real, not always sexy, but something honest and truth. That if you start it, it's going to affect the serotonin. So the sexual component is so important to understand that if you take steroids, not to mention even testosterone, it's going to have an effect on your sex. And I hope it's great and sustainable. Last part here on the S is going to be PSA, which is your prostate. If you're a man, you're over 40, as you're getting older, you have to check your prostate, digital rectal examinations, and PSA, which is prostatic specific antigen, which is a blood marker for tumor cancer risk. And it's a blood exam. And primary care doctors do it, urology doctors do it. So you really have to check that. And any androgenic stimulation you give to yourself, if you have underlying prostate cancer, rare at 40, but not rare when you're 60 and 70. So along that spectrum, what's happening to your prostate? In the end, guys, it's going to be really the heart and the prostate that's going to really dictate the longevity and the quality of your life. And I want you to make the right decisions to kind of keep things to a down low. And maybe don't take steroids if you don't want to deal with all this stuff. It's not worth it. Or maybe just try TRT if you need it. And I want to close on this, guys. The Anabolic Doc app is a resource that has access to all my information uncensored. And it also has access to what's called the man-to-man meetings, where I'm running these meetings all around the world with men. And you can ask questions and I answer them appropriately. Some guys are censored out as far as they turn the cameras off and they just ask questions and they listen and I respond. Everyone, it's the real group meetings of men. And they're twice a week. I'm adding another day because we're growing all over the world. And this is a resource where I'm able to give back to you guys and even respond to your questions with a mailbag and make a video. I love videos. I love videos. So it's multi-dimensional, multimedia for you to really understand. Of course, these are men mainly on androgens, understanding all the risks, really from a primary care perspective. I really hope this helps you guys. Get a lot of comments, and thank you so much.